Hi, everyone. It's Traci coming to you live from the Country Dog Walking Club headquarters. And I am here tonight with Dr. Lisa Boyer for our Ask the Veterinarian series. How are you, Dr. Boyer?
Hey, I'm great. How are you?
I'm doing well, thanks. Good to talk with you again this month, as always.
Hey, it's going to be fun.
So it is Animal Pain Awareness Month, as I know that you are aware of. And I know we have a lot of really important things to talk about tonight as it relates to pain in pets. We have our number of questions as well that have been submitted prior. And I know that you also have a number of different links and items online that you want to share and talk about. So before we start, why don't you tell us a little bit about yourself for people who might not be familiar with you and what it is that you do as a veterinarian?
Oh, great. Thanks, Traci. So I have been practicing veterinary medicine for 19 years, 19 and a half, I guess, years at this point. I started out as a general practitioner and also emergency and critical care, and my focus has generally been on emergency and critical care in terms of clinical practice. But in that realm, I'm also certified as a veterinary acupuncturist. I've had post doctor training in a lot of different modalities for pain management, alternative therapies, Chinese herbs, food therapy, and then because as an emergency doctor, we deal with pain a lot. It is an area of interest for me in trying to keep pets comfortable via a variety of modalities, medications and otherwise, and not just have, one or two things in my wheelhouse. So this is a great month to talk about this. I'm also a consultant. I do spend time with clients, reviewing charts, second opinions, helping them understand what's going on with their pet, trying to, maybe make suggestions that other veterinarians might not have thought of yet, things like that, just because I've got a pretty wide spectrum of the things that I do. Although I love cats, I have focused a lot. My favorite is dogs. I mean, even though I'm equally proficient in both canine and feline medicine, I'm not, I used to do some large animal. I don't do that anymore. I'm getting too old for that stuff. So mostly companion animals.
But you've dabbled in just about everything, it sounds like.
I have. Well, it used to be 19 years ago, you didn't specialize, everybody did everything. Okay. And now, now it's more, so my training was in mixed animal. I worked on farm animals, horses, cows, sheep, goats, pigs. But I also did a lot of small animal in my training. It was just the school that I went to taught you everything. And I do find that it helps me in the small animal realm because I'll MacGyver something for a dog that maybe worked in another species that some other people might not have tried before. So it works.
I love that. You're the MacGyver of the veterinarian world.
I try.
Well, we've been doing this series for a number of months now, and I know it has been extremely beneficial to people. They have thrown some really good questions your way, and you have been able to give them, answers, tips, ideas, resources. It's been so helpful. So I appreciate you again coming to, to our audience live to talk about pain management and pain awareness in pets.
Sure. Thank you. It's a great topic today.
Yes, I agree. And what do you think is best? Should we start with the links that you have provided, or do you want to get into the questions?
Let's start with the questions. I think the links that I'm providing are going to be put in context. So it's just something that I might reference as we go.
Okay, perfect. So this was one of the first questions that was submitted. Someone asked, what are your thoughts on the respiratory virus that is around right now that seems to be causing more cases of pneumonia?
Well, good question. Not pain management specific, but excellent question. I think it's bad. No, I mean, it is. It's horrible. We have had a huge outbreak in many places in the country, especially the Eastern Seaboard. I started to see it around some dog shows, things like that, or dog boarding facilities or puppy daycares. We would get dogs come in that would present with kennel cough. And kennel cough is a complex of, it's a respiratory disease. It's an upper respiratory disease that's like a tracheitis, an inflammation of the trachea that starts off, just doesn't get in the lungs. It stays in the trachea, and it can be around for a couple of weeks. Dogs are contagious for 3+ weeks, and then it goes away. People say, oh, my dog's vaccinated for kennel cough. Well, yes and no. Kennel cough only is for one particular pathogen called Bordetella. The canine respiratory disease complex can be many pathogens. So we can actually see kennel cough not just from Bordetella. In this case, when a dog comes in coughing like a seal, which is usually what it sounds like, that barking, barky cough, and we say, oh, you've got kennel cough. It used to be vets would just say, well, here's some antibiotics, here's some cough suppressants, go on your merry way, see you in 3 weeks. And the dogs would be fine. Lately, what we're seeing, however, is the antibiotics that we typically use for kennel cough are not correct. So then how do we know what we're treating? And fortunately, veterinary medicine has progressed to where we have some amazing diagnostics. And in some of these dogs, especially that have been coming in lately, that are getting super sick, we've been able to take certain swabs and do a test in the lab before they get on antibiotics called a respiratory PCR. And my colleagues and I have seen lately, if the owner will do that test, if it's not responding to regular antibiotics, we get the test back, we know what we're treating, which is great. And lately it's been something called mycoplasma. And mycoplasma is a pretty difficult pathogen sometimes, and it can be quite virulent, and these dogs get really sick, and it progresses then into a pneumonia. And we've had dogs that have been hospitalized in critical care for days and days. We've had dogs pass away from it. So my thoughts are that, yes, there's something going around that's really bad right now. It's probably mycoplasma. There may be other pathogens at work. Yes, kennel cough can progress into pneumonia, especially depending on the pathogen that it is. So what do? The dogs that are vaccinated for Bordetella tend to get less sick than the dogs that aren't. So I would say absolutely make sure you're vaccinated, the dog's vaccinated for Bordetella. That vaccine, although it's licensed for 1 year use, I think we see the effectiveness of that vaccine waning at about the 8-month point. So I would tell you that if I were going to board my dog or have my dog around a large group of other dogs sharing food and water dishes, all of those things, I would vaccinate more frequently than every 12 months. I would probably say every 8. Okay, maybe 10 months. Okay. And because it's a virus that, or it's a vaccine that doesn't confer natural immunity long-term, like some of our other ones, like distemper or parvo, which really every few years, 3 years or so, or even sometimes every 5 years, depending on your dog. So that's number one. If you're in a high density population with dogs, I would not share food and water dishes right now. Don't let your dogs drink out of other dogs' buckets. Okay. And if, and just be aware that if you hear your dog coughing, that they are probably contagious immediately. It takes about, from the time they're exposed to the time they would develop signs, usually it's about a week, within about a week to 10 days of exposure. It could be sooner, three days, maybe. I say 3 to 7 days, 3 to 10 days, the dogs start coughing, and then they're going to be contagious for at least 3 weeks.
Now, this might seem like a strange question, but you don't think this is some kind of variant of the COVID virus that is just occurring in dogs, do you?
No, I don't at all. And there's no indication of that at all. And that's a really good question because, we kind of were joking, well, maybe we have doggy COVID, but no, we have actually cultured out what it is. I mean, it's pretty definitive. There's no indication whatsoever that it's COVID related. Okay, so that's a good thing because that would be a nightmare, actually.
Good to know.
So.
Well, and I know based on your advice too, we stopped encouraging people to share water bowls at our events, which a lot of people do. Sometimes people forget to carry water.
Right.
So we've definitely tried to nip that in the bud. So we appreciate you. You're always just so on point. Anytime you see something, bringing that to our attention so we can pass that along to our members. So
yeah, and it's hard because you can't always control which water dish your dog drinks out of. But if you can keep your own supply with you, and then if somebody's going to, if people are out playing with their dogs and you're in a group of dogs, not handling one dog's mouth and going right to your dog. I mean, because it can be transmitted through clothing, through, so if a dog is slobbering on you or kissing you or whatever, and then your hand or on your hands, and then you go and then put that in your own dog's mouth and nose area, it comes in through the nose, that's problematic.
Yeah.
So.
Okay. Good feedback.
Thank you.
I think we've got a couple more here that aren't specifically related to pain, but
are
good nonetheless. So here's one too about frogs, toads, and mushrooms. I know there's been a lot of talk about that.
Yep.
Which are poisonous, and what do I do if my dog eats or puts it in their mouth? Brutus had a frog in his mouth. He was foaming at the mouth. I know that Michelle said he is fine.
Yep.
But she didn't actually realize that he had a frog in his mouth.
That's right. And not all frogs are poisonous. Okay, not all toads are poisonous, but certain ones are. And so usually when a dog gets a frog or toad in their mouth, it creates this just massive drooling, hypersalivation, foaming reaction. The best thing is to get it out of their mouth if you can, and then grab a garden hose, and the solution to pollution is dilution, and just flush that mouth. Don't let them aspirate and get that down into their lungs. Hold the hose sideways and just run that in the mouth as long as you can until that stops. And, nice cold water hose and just flush the mouth, because that's really what we're going to do. We're going to get rid of that flush. In terms of mushrooms, it's difficult because there's so many species of mushrooms out there. And one of the apps that I really like, I don't know, that you can get on your phone, is called Plant Snap. I think we've talked about this during the toxicology one before. And the Plant Snap doesn't always do a great mushroom ID, but sometimes it does. And mushrooms are super difficult because if it is like an amanita or one of those really toxic mushrooms that your dog's ingested, it attacks the liver and causes liver failure, and dogs die, and it's very, very toxic. So one thing is, if you know what kind of mushroom your dog ate, they need to ingest it, first of all. Putting it in their mouth and spitting it out, not going to be a problem. They need to swallow it to cause a problem. So if they eat it, number one, with as quickly as possible, we want to get them to vomit. Okay, that's really important. And I don't generally, unless you are not close to veterinary care, I don't recommend inducing vomiting at home, because you generally have to use something like hydrogen peroxide, which can cause stomach ulcers. And that's why I don't like to use it. Certainly if you're 3-4 hours away from veterinary care, absolutely, I would do it. But if you're not, if you can get over to your emergency clinic or your regular vet clinic, they have medications that they can use to help your dog vomit that will not cause those kind of reactions. Okay. And grab a sample of it if you have it, so we can identify it. Picture sample, the mushroom itself is great. Animal poison control is always a good thing to do, but it takes a while to get through to them right now. It's tough. I mean, you can be on hold for a half hour. You don't want to delay care while you're trying to get through to them. So you got, I would say take your dog in while you have somebody on the phone trying to open up a case with animal poison control. Generally, dogs that ingest mushrooms, if they've swallowed them and we make them vomit, it's still not all you need to do. You still need to seek care, because mushroom toxicity, depending on how, we don't, when a dog vomits, they don't vomit 100% of what's in their stomach. We get about 70 to 80% of stomach contents out. And so hopefully, whatever's in reserve, we want to neutralize if we can. And for dogs that are really at risk of like from an amanita, there are specialty places that have got new procedures, even where like they drain out the gallbladder through with an ultrasound. And I mean, there's all sorts of things to try to prevent, the patient from dying. There's a number of procedures that can be done, but it's tough. I mean, mushrooms are tough. So depending on identification is key. Yeah. So identification and getting them to absolutely vomit and to seek care and check those liver values and get them on IV fluids and treat them for whatever symptoms we're seeing at the time. It's very good.
Well, I know this year too, with all the moisture we have had an abundance of different types of mushrooms, things that I've never even seen before.
Yeah, it's really hard.
I think trying to be proactive and taking this app that you recommended, Plant Snap, and going out into your yard and understanding ahead of time what's poisonous, what's not, and maybe even trying to eliminate what is.
Sure.
In the hopes that, I mean, I know my dog likes to eat. She doesn't necessarily scrounge, but if your dog is a scrounger, maybe that's a good proactive measure. Would you agree?
Yeah, absolutely. I think it's a very good proactive measure. And I'm going to circle back for a minute back to the toads, because I didn't answer specifically which ones were toxic or not. I know we were talking. Okay, I want to just make sure I do that. So the good news is almost every toad is generally mildly toxic. Okay, so we would rinse them out just kind of like what we did. Sometimes the toad, if they eat the toad, it can cause vomiting. Okay, so that can also happen. But there are two toads that can cause life-threatening symptoms. And I don't think we have them here. Actually, I know we don't. One is called a cane toad. And a cane toad is in like Florida, southern Texas, and Hawaii. And then there's another one called the Colorado River toad, and that's mostly Arizona, New Mexico, and California. So I would say the ones here, unless somebody has a transplanted toad from another location, we don't really have to worry a whole lot about. It's going to be a mild reaction. And so if you don't live in those areas, I don't worry too much. You can always, if your pet for some reason has a toad in its mouth and they're conscious, we're going to rinse that mouth for like 10 minutes. If they're not conscious, let's say they got into something else, we don't want to rinse the mouth if they're not fully awake, because then they can aspirate that down into their lungs. So that would be the other piece. Okay. All right.
Okay.
So hopefully
Good
that
question and good answer.
Yeah.
All right. Excellent.
And I can't tell you which mushrooms, because there's millions of them that are poisonous and not. And I mean, it takes a book about that thick. So,
well, that Plant Snap app.
Yeah, Plant Snap might happen. There are other ones too, not just Plant Snap. There's other ones out there. You can search for mushroom identification app or plant identification app. So,
okay. The next question is, other than the cone of shame after being spayed or neutered, what other alternative options are there? Like donut, short, surgical suit to prevent licking and such?
Beautiful. This is a fabulous question. So I love it. I am one of those people who I do not like the cone of shame because they hurt. They hurt me. Because the dogs, with their legs and the plastic hurts. I wind up with bruises all over my body. There are some great alternatives depending on your dog. Now, the donut one that the person who asked the question it's basically an inflatable donut that goes around the neck. Okay. That one is okay. However, many dogs, if they're persistent enough, will be able to get it off, or they'll pop it. And they're expensive. They're like $30 at Petco. Okay. So if you have a dog that's mellow and you're not worried about them messing with it, they're great. But if you have a dog like a crazy lab or a high-strung dog, probably not a great idea. There is a collar. I'll see if I can give you a link to this. Just give me 1 second. This is something you don't see a lot here, but I have used these in the past, called a bite knot collar. I'm going to give you a link to this. Okay. If you know, this one looks more like, have you ever seen those cervical collars that they put on you when you have a car accident and you think you hurt your neck? Yeah. It's kind of like that. So the dog this works really well. The last link I just sent you, you could maybe share up and just for people to see what that looks like. Yeah, absolutely. It's kind of a little different. Get out of that. Share. All right, so there we go. Oh yeah, look at that. That's really different. Yep. I don't see these a whole lot, but they work really well. And you can order them online pretty easily. And then I'm going to give you another, I just sent you another link. They also make a surgical suit. This is one of them for after a spay or neuter that would work. And then if your dog had surgery that maybe involved the legs, they do have like these dog onesies that are post-op that actually cover all 4 legs. So they can't even chew on a leg. That's the kind that Dakota had after she had her surgery on the side. The suit actually worked really, really well for her. It's awesome. I love these if your dog will tolerate it. I really like them. And this isn't the only brand. There's plenty of them out there. Some are made out of more like a Lycra spandex. I used them on my cats after I spayed my cats because I didn't want them to be in a cone, and it worked really well. I mean, they come in all different sizes. The downside of these is you have to prepare ahead of time. So if you know your pet's going to have surgery, do the research ahead, find a post-operative surgical suit, figure out the material, see if you like it. I would definitely buy, if you're going to use the Lycra ones or you might want to buy 2 of them so one can be in the wash, because especially coming into the rainy season, the dirty season, you don't want that area over the incisions to get dirty. Yeah. And so I would use those. Now, fortunately, I always recommend e-collars or some kind of suit, donut, bite knot, something after surgery. But there are dogs who, depending on the technique that was used and if the sutures are not external, a lot of dogs don't mess with it at all. So I tell people, have it on hand, take your dog home, see if the dog is licking or the cat is licking. If they're not messing with it, great. But at night when you're sleeping, you need to have something on, and then take it, use it when the dog's not being supervised.
Yeah, we had like 6 different suits because I just didn't know what would work for her. She didn't like the Lycra ones because she's a real fluffy dog and she would get real hot. It was in the summer. So we found this nice light kind of jammy material that had the legs like you mentioned.
Sure.
It worked perfectly, but it would get dirty and it was the only one I had. And then she would go under the bushes to try and scratch the area and it started ripping. And I'm like, oh my God.
Well, you can also jerry rig some baby, depending on the size of your dog, not for big dogs, but you can sometimes take little kids onesies and pajamas, like the onesie, you sometimes can even use those.
That's a good idea.
Yeah. Or sometimes doggy sweaters, doggy coats, t-shirts, cut a hole for the bottom, for the tail if you need it. Lots of different things you can jerry rig depending on where the incision is and what you're trying to cover.
Yeah, good point. Because those suits can be expensive. And if you end up not using them or you wear them once and the dog rips it or something, you can't send it back. So
exactly.
Good advice.
Thunder shirts also cover a good portion, depending on if you use a thunder shirt anyway for your dog for anxiety during thunderstorms. They sell those at Petco, PetSmart. They're not cheap. They're like $50, but the way that they wrap actually would probably cover a spay incision. So that may be another alternative in a pinch.
Okay, excellent. Good to know.
And it also decreases anxiety because of the pressure in the swaddle, which post-op might be nice as well, as long as you're not putting it on really hard. You don't want to wrap it too tight.
Excellent. Good advice. All right. So our next question is, my 15-year-old lab has serious separation anxiety. What do you recommend? Today I gave him 25 milligrams of trazodone.
Yes.
And that seemed to help some. So now I do know she had a whole big, long scenario that she was sharing with us in regards to him. He's better than he was when he was younger. But one of the things that they saw most recently when they came home is that he had rubbed his nose raw on the rug while they had been away for the day.
Yeah,
so
sure.
Just really weird, odd things that he's showing and demonstrating that are really making them concerned.
Sure. And there may be, and I'd have to get a lot more information. I can make some general recommendations, but as dogs age, some tend to get canine cognitive dysfunction, which is like for lack of a better word, doggy Alzheimer's. And they can have changes in their sleep-wake cycles, where they start getting more anxious, panting, pacing, not settling down. Sometimes at night, that's when that happens. They can also, if they had an otherwise underlying anxiety disorder, we can see a worsening of that underlying anxiety. So separation anxiety is a huge problem. And it's actually one of the number one reasons dogs are relinquished to shelters, believe it or not, because owners can't handle the destruction that happens and when the dog is home alone and this happens. So there's some medications can help. Certainly trazodone is used as a sedation anti-anxiety med. Some dogs do quite well, and some dogs it doesn't work at all. It depends. Some dogs do well on Prozac. Your veterinarian would have to prescribe something like that. And there are some other medications that can be used, but I want to show you guys, I'm going to give you another link. And I really want to put this one up because this is something people don't consider. And this is, okay, there is a website. I'm sorry, I'm just getting this link up for you.
Yeah, absolutely.
So one of my questions would be, does her dog have just separation anxiety, or is there some issues of cognitive decline? Because I would treat that differently than I would just straight separation anxiety. So if it's worsening with a 15-year-old dog, I would have to say, okay, what other symptoms do we have? And do we have now a combination problem? Because I might add in something like melatonin. I might add in some other supplements. And as we talk about pain management, there was a link I'm going to give you, and I'll talk about it in a minute, that might actually help with anxiety. So this is something called Calmer Canine. You don't need to be a veterinarian to order it, which is great. So an owner can order it directly from this company. And I know it looks goofy, but what it is and I'm going to talk, when we talk about pain management, they have another device for pain management, and it has this kind of a loop. that attaches to a harness. It looks like a little halo over your dog's head. And it's a pulsed electromagnetic therapy. And what the research has shown with this is you use it twice a day for like 10 or 15 minutes, maybe twice a day. And you do that for so many weeks. And the unit will be fine. It's battery operated. It'll totally last. And they see a significant reduction in the amount of anxiety overall from these dogs that use this device. It's really impressive. So that is one thing that if I had a dog that had separation anxiety, it's a safe and drug-free solution. I'm not going to tell you that it'll work in 100% of the dogs because it won't, but the ones that I've used it on have a reduction in anxiety. So I think that it's pretty helpful, not just for separation anxiety, but anxiety in general. So that's one option. You could, again, and drug recommendations I can't make in this forum. If the person who has the issue with their dog wants to do a consultation on it, I'm more than happy to help. Separation anxiety, there's a training component to it as well, but in a 15-year-old, that may be really tough because, we're not going to have the same effect as if this was a young dog and we're training for separation anxiety, but medications for sure are available. There's herbal things that can be done for anxiety, and acupuncture as well, believe it or not, would be quite helpful for this dog. I think to calm anxiety in general. And then I'm going to bring up a website that people are actually, you have it on there, the Elevet website, although I want to use that to talk about pain. Elevet is probably, if I really don't make a lot of CBD, recommendations because, we're not supposed to prescribe it as a veterinarian. However, I can tell you with personal experience, number one, this product is probably the best canine product out there in terms of quality. It's extremely well manufactured and tested. If you call them and you talk to them about the issues, they will recommend which product for them. They're very knowledgeable at this company. I've used this for anxiety for dogs, and I find that it's really helpful. I think so. This was Elevet is a great company, and I feel pretty strongly if I were going to buy a CBD product, because they do all vary in effectiveness depending on their manufacturing. This is one that works pretty well. Thunder shirts, even though it's not thundering out, that can help as well. Another non-drug intervention. I'm trying to think about things. There is a Purina, and again, it's not going to be able to be used, be instantly affected, but Purina has a product called Fortiflora. Have you ever heard of that before? It's a probiotic.
No.
They have a new product out. I'm going to put this one up too.
Okay.
Just thought about this. Now, this is not going to be for the dog who is tearing your house apart, but it would be used as part of a multiple product or intervention. We wouldn't just do this alone. It's not going to be enough. It's called Purina. Here it is, Calming Care. It's in it. The bacteria in the gut talk to the brain. And we know that dogs who have seizures, for example, do better when they're on probiotics. They have better seizure control. I just sent you that link if you want to put that one up. And it's a nutritional supplement. It's a probiotic, but its blend has calming agents in it and that have been known to help ease anxiety. So this would be one more tool to put in that toolbox. Your vet can order this for you, I believe. I think this is a prescription product, but I'm not 100% sure. It may or may not be, but this would be another thing. You could also use something called Rescue Remedy. Again, not something that would work for a severely anxious dog, but you could use as another tool to try in addition to what you're already doing. I can give you an Amazon link to this. It comes in a spray or a tincture. It is a natural product. The spray I like because you can spray the inside of the ears. You can put a little squirt in the mouth. You can actually even put it into the environment. If I were going to use a dog carrier or crate, I could spray the inside of the carrier. I just gave you that one. This works really well to ease anxiety. They also have a tincture where you can put a couple of drops in the mouth. Sometimes I spray the dog's paws. That can help. as well. This is a really nice product.
Excellent. Those are a lot of great resources.
Yeah, lots of stuff you can do.
Yeah. Okay. Good. All right. So let's remove that from the screen here, and we'll go to our next question. These are great questions, guys. Thanks for submitting them.
Yeah.
So let's see. We have.
And then eventually we'll get to pain, right?
Yes, we are just about there. I'm going to do the last one that's not pain related, which is this one. What are your thoughts on feeding puppy dry food? Purina Pro Plan puppy, but putting a little meat or fish on top. She will not eat veggies or fruit. Someone suggested baby food.
Okay. So, dietary recommendations are really, really dog specific to me. But when we're talking about puppies, and I'm going to preface all this saying, I'm a dog breeder, I'm a veterinarian. I do not, and I'm going to give you a financial disclosure. I receive zero compensation or product or anything from any pet food company. Okay. So my views are my own independent views, and my experience over 19 years of both breeding dogs, purebred dogs, and being a veterinarian, and what I see. And I've raised a lot of puppies over the years. So, and I've raised everything from hunting dogs to companion, little small yippy companion dogs, Tibetan Terriers. So out of all the puppy diets out there, I think I like the research and formulation that's gone into Pro Plan Puppy. It has DHEA, which is certainly critical for neurologic and brain development. It's got some things in it that other products don't. It is probably one of the most well-researched diets out there, and I think it's exceptional for growth. However, with a caveat, not all dogs do great on this diet. It depends on the dog. Diets are very individual for the dog. I've raised litters of puppies on Pro Plan Puppy, and they've done great. I've had others where, their stool quality is not so great. Their coats don't look as great. And so, it just depends. It's very specific to the dogs. Fromm's Puppy Gold, I like. Again, I don't feed grain-free because of the risk of heart disease. We've talked about that before. But, I like Pro Plan Puppy. And I have some of my dogs I feed raw because those dogs need that because they don't do well on kibble. So if the stool quality is good, your dog's growing appropriately, their coat looks good, I wouldn't change the Pro Plan Puppy. Now, in terms of what to put on top, that's always great. If the dog eats it with nothing on top, you're fine. But if you want to be that person who spoils their dog, which I am, okay. Baby food is okay if it's a meat-based baby food, but you need to read the jar and make sure there's no onion or garlic in it, okay? And baby food does not have a lot of calories in it. So if you're trying to keep the dog trim, that's great. So that's not a bad alternative. You could add a little canned food. I tend to, for my own dogs, I should buy stock in the company, but because I have 6 dogs, I like Merrick canned. That for my dogs, they like it. There's a lot of wide variety in flavors. I used to have a chicken allergic dog, so I had to be very careful. And they had plenty of flavors that were chicken free, poultry free, so it was easy to use. So Merrick canned is fine. Fromm's is good. There's a few other brands out there that are all good. I don't feed anything that has legumes or legume-based protein or sweet potato or potato in the first 6 ingredients. And that's mainly because of the research into the heart disease associated with those diets. A little bit of lean meat or fish is totally fine as long as it's cooked. The fish should not be raw. Salmon in particular, dogs can get very sick from raw salmon if there's salmon poisoning is a disease in dogs. Especially if you just went fishing and pulled salmon and they ate raw salmon. I tend to say lean. So you don't want to be using prime rib, fatty pork, things like that, because that can cause a little pancreatitis and cause digestive upset. But chicken, turkey, lean beef, a little bit of lean pork tenderloin, a little piece of pork chop, that's okay. Again, no onion, no garlic, and the fish, just make sure the fish is cooked.
Oh, okay. So there's quite a lot of options there.
Oh, sure. Yeah. I stay away from deli meats mostly because of the salt content. I don't like things that are super salty for dogs. As a puppy, it probably won't hurt, but I don't like to get them on, that kind of trend.
Okay. Excellent. All right. So that looks like that's all of the questions that don't relate to pain. Sweet. So this next question here. Oh, I like that ringtone.
Yeah. Oh, no. Traci, give me, I apologize. I need
Not
1 second. Can you, I'm going to mute mine just 1 second. I apologize.
I'm going to mute you. All right. So Lisa has to take an urgent call, or Dr. Boyer has to take an urgent call. So I see that you have some questions coming in, guys. And let's see here. I'm going to throw this up from Michelle. Let's see. Thank you. Googling when this is happening is scary because they say you have so much time to pet them to get them to the vet before they could die. They don't tell you where the poisonous toads are located. Yeah, I hear you there. That is scary, Michelle. And we're seeing so many different varieties of amphibians. And are you? Yeah, just unmute yourself. Or did I?
Good. I got
There
you.
we go.
Sorry about
Okay.
that. I apologize.
Good.
That was
No,
yes.
no problem at all. I was
Right.
just chatting with Michelle here because she was so worried about the toads and mushrooms scenario because, you know, you just don't know. What do I do? Do I get them to the vet? You know,
Yeah.
just time is of the essence, really. So that was a good question you brought up, Michelle.
That was a
And
great question, Michelle.
hopefully
I really
you got
like
some good feedback from Dr. Boyer there that you can use if it ever happens again. Brutus, no frogs.
no frogs. No frogs. Okay, so
All right, so let's see. Let's go back to, we've got this one right here, and this one comes from one of our training partners. She asked, how do vets identify pain in dogs when there is no obvious injury? For example, do vets do a gait analysis, a physical exam, a pain management trial? Talk to us about that.
All of the above. That's good.
Okay.
This is a really great question, and I think there are vets who are more skilled than other vets at assessing pain. So there's a very wide continuum. You know, it used to be 19 years ago, there was a whole school of thought that animals didn't feel pain, which is crazy. We all know that that's not true. You know, and people would say, oh no, don't give your dog pain meds because then it's going to feel too good and you're going to hurt it more. I mean, there was, and people would be really shying away from pain meds. And if you can even imagine this, back when I first started practicing and you had your dog spayed or neutered, you could, as an owner, pain medication to go home was optional. Can you imagine having like a massive abdominal surgery and sending your dog home with no pain meds?
Oh my goodness.
Now, we don't do that anymore.
Yeah.
Okay. Obviously, we've come a long way over 19 years. We know that dogs feel pain. We know that cats feel pain. And in some cases, they can feel it more acutely than we can. And so it's super important to address pain, whether it's an acute pain, post-op pain, or something that's a chronic issue. So there are, and dogs can't tell you, oh, mom, I hurt, or dad, I hurt. So you have to watch for changes in behaviors first. So is the dog sleeping more than normal? Is the dog stiff to rise, but then after a few steps feels better? Is there any kind of a limp or change in gait? Certainly that's interesting. Have we had a change in, you know, activity level? Like, are we no longer wanting to play ball or not? Are we eating the way we used to? Sometimes dogs stop eating when they're painful. I mean, that's just how it goes. I mean, that's the only symptom you may have. They're not eating. Dogs can have pain that causes them to vomit. You know, I mean, if it's severe enough. So there are a lot of hallmarks of pain in dogs. Just so anytime you have a behavior change, that's the first thing I would say. We always want to be on the alert. Is there pain somewhere? Okay. Dogs, you know, I have people come, oh, my dog's not painful. They're not crying. Well, it's rare that the dogs are crying in pain. It's actually all the other symptoms we see much more often, especially in chronic pain cases. So for me, the first thing I do whenever I see a patient is I do a thorough physical exam. I'm going to touch every single bone in that body that I can, and I'm going to flex, extend, you know, see if they're painful at all to any of the manipulation that I do. I'm going to take the head and neck. I'm going to rotate it. I'm going to bring it up and down. I'm going to go right down the spine. I'm going to look for neurologic deficits. And do I see any weakening reflexes? Is there any muscle atrophy? You know, meaning that muscles aren't as strong as they used to be. And so we're going to look at all of that as part of a physical exam. Definitely gait analysis. So if you go into your vet's office, you know, most of those exam rooms are pretty small, right? And most of the time your dog's in, they pop them up on the table, they examine them, and they go, okay, and they let you go. Well, did they watch your dog walk? You know, maybe not. You know, sometimes they don't do it. And sometimes it's a functional issue where we really can't watch a good gait analysis in an office that's, you know, 6 by 6. But other times the vet will be like, well, I'm watching that dog from the time it hit the waiting room to the time it comes into the room. So it depends on who's had eyes on the dog and the ability of the staff to say, hey, I see a limp, or I see this, or I see that. A lot of times my veterinary technicians will have watched the dog walk in and will have brought it into the room, and they'll say, hey, the owner didn't mention this, but I think it's lame on the left front or the left, and they're very adept at it. So it's a lot of it is something that will depend on the staff and the doctor that you see, but it's something you should ask to be done as part of your physical. I really want you to watch him walk and move and tell me whether or not you think we have an issue. If you think your dog is painful because of either a change in behavior or stiffness or anything else, one of the things that I tell people is, let's do a 3-day trial of some pain management, whether it's non-steroidal, anti-inflammatory, something else. And then you're going to call me in 3 days and you're going to tell me if your dog is different than it used to be. And if there's no change, then probably okay. But if there is a change, then we should look further on what to do.
Yeah, so basically don't be afraid to be an advocate for your dog. If you think that they're not seeing the whole picture, then ask them to.
Yeah, and you guys, we see your dog in a 10-minute exam, 15-minute exam. Right. You live with your dog.
Right.
You know much better. So a lot of times it's up to the veterinarian to ask the right questions. And there are some really good, I think on Hills or the Purina website, believe it or not, there's like these there's these pain management questionnaires for dogs, like that questions to ask yourself or your vet. I'll see if I can get you that link after the podcast, and you can then look at that to see if the, and you can take the questionnaire yourself and hand it to your vet, which is great.
Oh, that's a great idea.
And I like to do those because it's something super important that we don't want to miss, and people don't always know what to look for.
Yep. Okay. Good advice. Yeah. Excellent. All right. So our next question is, behavioral issues in dogs can be caused by undiagnosed pain problems. What do you say to a dog owner interested in behavioral euthanasia?
That's a really, really, really good question.
And there's a lot of that going on lately, I've heard.
There's a lot of, well, first of all, no veterinarian wants to euthanize a healthy dog. Right. So, that would be, and most of us will say no. So if somebody comes in to me and says, hey, my dog's bitten somebody, I want to euthanize him. Before we do that, I take a pretty thorough history and I take a look at the dog and we see what's going on. And if there's I advocate for that pet and say, let's make sure there's not a physical reason causing this incident that happened before we condemn this dog to not be on this earth. The last thing I want to do is have somebody get bitten by a dangerous dog. But if there is an underlying medical condition, we need to explore that. So things that can cause, aggression in dogs, undiagnosed thyroid problems, definitely can be an aggression issue. Are they on any other medications? There are a couple of medications that come to mind that they can have an idiosyncratic reaction that causes aggression. There's a very common allergy med that's given to dogs, and I've seen aggression in a couple of dogs on that medication. And when I went and researched with the company, it's in the very tiny print. It can cause aggression. It's rare, but I've seen it twice. So things like that can happen. Okay. Yeah. So you always want to look at that. Pain, yes, absolutely. You have a dog that's painful and somebody reaches out and tries to handle that dog or lift that dog up. Of course, it could be something that's pain management. Yep. So if somebody wants a behavioral euthanasia with me, they're going to have to pass my muster in terms of a thorough history and physical. Let's make sure that this isn't a pain management problem or an undiagnosed thyroid, or depending on the circumstances, obviously, but if we have a truly aggressive dog or a dog with a severe behavior problem that we've ruled out medical causes, even neurologic causes. I'm not going to ask somebody to do an MRI, obviously, and spend thousands of dollars that they don't want to spend. But if we have ruled out the simple stuff, and it's obviously not an illness and they've done some minimal investigation, then, if the dog is clearly not happy and is suffering, even if they have a mental problem, or aggression problem, they're suffering. They don't want to bite. They don't want to be mean. Then I can advocate for that, for the safety of the dog and the safety of the people around it. Okay.
All right. I know we did have one other question that came in here. Let's see. It looks like it's a big one. It says, hello, Dr. Boyer. Here's a question dilemma. Our dog needs to take Pro and 75 twice a day. My dog too. Yep. She hates the taste. My dog too. And whatever we hide it in, she will either smell it or leave it, not eat it all. My dog too.
Okay.
So are we thinking when it comes to food, we mix and change routines regularly with wet food, cat food, cheese, pill pockets, peanut butter, etc.? Is there a substitute medication we can use? Oh my God, I love this question.
It's a great question.
I swear it didn't come from me, but it's exactly my situation.
Okay, well, I got great answers for you.
Okay, good.
All right, number one, compounding pharmacy. So there are pharmacies out there that specialize in pet meds. One is called Roadrunner Pharmacy. Wingate is one. There's a bunch of them. Your veterinarian can speak with them, and they can put that medication into a preferred flavor profile. Whether it's a liquid, it can be in a liquid form, it can be in a capsule form, it can be in whatever it is. And they can probably find a form that your dog will take. Okay. Usually the cost of they'll send it to your house, which is even better. You don't have to go pick it up anywhere. Usually they will know, the pharmacy themselves will know what way it works best because they have the experience of thousands of people who have the same problem that you have. The other alternative is let's not use Proin. There's other medications on the market that work just as well as Proin. There are other alternatives that you can use instead of Proin. And so you might talk to your vet about shifting to a different medication that does the same thing, that doesn't have that same smell or taste. But I would personally try compounding first.
Okay, that's a good solution. I'm actually wondering if this is my husband that posed this question because it doesn't say the person's name. Like, this is my dog to a T.
Yeah, and you know, I mean, it's hard. I mean, the last alternative is pilling your dog without anything, and they do make pill guns. I don't know if you've ever seen.
Oh,
these.
yeah.
You know, and it makes it a little easier, where you just take the capsule tablet and put it in a little gun, or it's on like a little stick, and you just open your mouth, pop it in the back, push the button, and the pill's done. You know, so that can be done. Again, I prefer the nicer way of having it compounded into a flavor profile that your dog will eat. If you know, like there's a flavor that usually they won't turn down, then they can usually make it in that. Okay.
Oh, okay, interesting.
Yeah, I would definitely talk to a compounding pharmacist for sure. And they're really helpful. I mean, super helpful. Or worst case scenario, let's get them off of that and use an alternative medication because there's 2 or 3 on the market that can be used. Proin is common, but there's other alternatives.
Okay, good to know. All right, so now those are all the questions. So I am wondering, do you want to go over any of those links at all?
Yes, I do. Let's talk about pain in general.
Okay.
All right. So we started to talk about how we never used to recognize pain in dogs. And now we're kind of on the other end of the spectrum where we know a lot about it, although the research is still ongoing. Dogs absolutely animals in general feel pain, no question. The nice thing about pain management in animals is there's a lot of newer alternatives that are out there to manage pain. It used to be you'd go to your vet, and even more recently, even the last few years, they would put your dog on a non-steroidal anti-inflammatory like Rimadyl, Medicam, something like that. If that didn't work, maybe they'd add something else, Tramadol, right? I mean, I think people have heard of Tramadol. That's a mild narcotic. Well, research has shown that Tramadol in particular is really very variable in dogs. And I can tell you from a human perspective, I've taken Tramadol, it does nothing for me. And it's the same in dogs. Some dogs it might help in conjunction with a non-steroidal anti-inflammatory, and some dogs it won't. So I cannot remember the last time I prescribed Tramadol because I tend to say, well, let's use something that I know works. Okay. So usually if the pet does not have kidney and liver problems, we tend to like to use non-steroidal anti-inflammatories for things like osteoarthritis. You can use things like there are narcotics you can add on top of that if we need to go into the narcotic realm. I try hard not to send home controls if I don't need to. One of the things that has recently become popular and not, I don't think in a good way, is something called Gabapentin or Neurontin. It is a drug that's used for pain in animals, but the research really shows that it's not as effective as people think it is, or as we think it is. It's not good for acute pain, certainly. And it's really only good for neuropathic pain. So those nerve pain, and that's how it's used in people. You have severe nerve pain from your back, they might give you Neurontin. They don't prescribe it if you break your arm, so, and there's a reason for that because it's a different it's a different pain pathway. So unfortunately vets get limited in what they can send out and what's available or what their knowledge base is. And they go to Gabapentin, and Gabapentin is very sedating. So they think the pet's okay because it's sleeping. Well, no, you're just sedating it. You're really not dealing with its pain. Okay. So Gabapentin has its place in a multimodal pain management idea, but it's not the be all end all. So, we've got Tramadol, Gabapentin, we've got certainly your non-steroidal class of drugs, and not all non-steroidals are equal. Some dogs do better on Rimadyl, some do better on Metacam, some do better on Gabapentin. There's a wide variety of them, and it may take a little shift, back and forth and trying different ones before you find the one that works with your dog the best. Now we'll get into other medications other things you can do. I'll talk a little bit more about meds, and then we're going to go into other things that are not medications. I know everybody, and let me preface this by saying never, ever, ever give anything to your dog over the counter without consulting with your veterinarian. Absolutely no human non-steroidal anti-inflammatories, no Motrin, no Aleve, no naproxen, no, and any of that. That will very quickly hurt your dog and cause, death. So none of that is safe. Aspirin. Most people go, they'll have like an 80-pound dog and go, well, I gave him a baby aspirin. I'm like, yeah, that didn't do anything. that's like giving a 200-pound man a baby aspirin. It's just not going to do anything. So aspirin is not always safe. It's okay if that's all you have, but it can cause gastric ulcers very, very easily. And so I tend not to rely on aspirin. It also causes problems with blood clotting. So, just like it thins our blood as well. So daily aspirin is really not ideal. We have safer alternatives. Your veterinarian can prescribe, believe it or not, and again, it will depend on the size of the dog and the appropriate dose. So do not do any of this without talking to your vet, because there is a margin of safety in there depending on their size. Tylenol with codeine is used. We can stack Tylenol or Tylenol with codeine in different formulations on top of, in dogs only, not cats, on top of non-steroidals to improve pain management, and it works really well. So that's another alternative. So, and there are other drugs beyond that. I mean, we can, for chronic long-term pain, we can go into really significant things like transdermal patches for fentanyl. I mean, there's all sorts of things depending, if your dog has bone cancer, I'm not going to send you home with, something that isn't going to appropriately help your dog. So there's a lot of drug alternatives that can be used, and you want to find a veterinarian who's really skilled and isn't just reaching for the Rimadyl and the Gabapentin, because once you're out of that realm, where else are they going to go with it? You can do, depending on the pain, transdermal lidocaine patches. You have to shave your dog so it gets in the skin, but it is an option. They use it in people quite effectively. So there's other, depending on the dose of lidocaine, we have to be careful in animals, but that's another alternative. Now we'll shift to the non-drug things that we can do. And I think that these are really, really critical. So like we talked, I'm going to kind of go down to that Elevet that we were at before, that first link.
All right.
All right, that one, perfect. Elevet is, again, it's a CBD. They have a pain-specific product that works really well. It's not going to be good for, again, as part of an approach. Usually it's not enough by itself. You're going to need to do something else with it. But if let's say your dog's on Rimadyl or something and it's not enough, add this, it may very well be enough. Okay, so there are things you can do with this, and this has to build up in the system to really work well long term, but it works well, and not in every dog. Again, everybody's an individual, so this may be an option. Other things that you can use to help would be, you see the Assisi Loop one? Okay, Assisi Loop. Can you scroll that up a little or open it so it's a little? There we go.
Oh,
all right.
okay.
There we go. Now this company, it's not just the loop. They have actually beds that, if you want to spend more money on them, that are pulsed electromagnetic beds that they can sleep on. They're a lot more expensive and tend to be used more in a clinical setting. But this is something that's very affordable to an owner. I want to say $150 or something like that. It'll last maybe 20 plus hours of use, maybe a little more. You put this loop, it's a pulsed electromagnetic therapy, over whatever spot is painful in your dog. So if they have hip pain, you just rest that loop on the hip, okay? And you push the button, and it takes about 10 minutes to cycle, 10, 15 minutes to cycle and do its voodoo. But I will tell you, I've used it on myself. My husband's used it. It works. It really works to decrease pain. It's effective. This would be used in a very chronic pain setting, like if you have a dog with arthritis or something else. Not great for surgical pain necessarily, but something that can help. Okay. And you don't need a veterinarian's prescription for this. So this is something you can go directly to their website and order. Or if you're having trouble finding it, I certainly can assist people with that because I do have them. Okay. So I really like those. The next thing I want to see, the one that says AdaquanCanine.com. Yep. Nope. Go below. Next one. Next. There we go.
Adequan Canine?
Adequan Canine. So Adequan is an injection. Your vet may already have it in their office, but they may have to order it. It's not super inexpensive initially, but it's worth it. So Adequan is a natural substance. Like, people talk about glucosamine, right? Animals, I give my dog a glucosamine. The problem with glucosamine in humans and animals is it has to go through the stomach and get digested before it gets to the source of where it needs to go. So it's really sort of effective, not great. Adequan is like an injectable glucosamine, okay? And it's not injected into the joints, but it's injected into the muscle. So if, and sometimes like when I acupuncture a dog, I might even use this at acupuncture points. But just even if your vet's not an acupuncturist, they can do an injection. Everybody has different protocols, but I tend to tell people we do 2 injections a week for 2 weeks. So we'll go for a series of 4, see if it's working. You'll know by the 4th injection if we're doing better. And then we'll start extending that out. Maybe we'll do 1 the next week. Then we'll do 1 every 2 or 3 weeks. Then we'll do 1 every 4 to 6, and then as needed, And so you just, and some veterinarians will will give you a prescription for this and teach you how to do the injections at home, depending on their comfort and your comfort. It's not very hard to do. So this is something that is a natural anti-inflammatory. It can be used even if a dog has liver problems or, you can't use non-steroidals. It's extremely safe and effective. So I really am a big believer in Adequan for things like osteoarthritis or chronic pain. Okay. I really like this product. And it's cost effective. And I've seen the difference of using it versus not using it. And I think it really is worthwhile. So that would be something to consider and you can ask about. Other things that I like to include would be at your veterinarian, they may have something called a cold laser. Cold laser therapy. Let's pull up a picture of what it looks like for you. And I'll explain what it does. So your vet, this is a very typical one. I'm going to give you a link to this. A lot of vets have this. Okay, let's see if you can pull that one up. Did you get a link there? Yeah, there we go. Okay, this is called the K laser. There's a lot of different brands. Some veterinarians will have this in their office. Many do, even if they're not big into orthopedics or anything like that. Cold laser is basically a high frequency laser that the best ones are class 4s, which is what this one is. And they have treatment protocols at certain wattages and that are designed in the system. And if you have pain and they use that laser around that pain area, it brings inflammatory mediators and prostaglandins and other things into that area that's painful, and it reduces inflammation. What's amazing about cold laser is it's incredibly good for wound healing. So if you have a pet that has a really bad wound or even post-op, and let's say you have a pet that, just has this really awful wound that maybe we weren't able to suture closed and because it's just too old and you can't do that. If you use a laser, you're going to increase that you're going to make that healing time much shorter. I've had animals that there's no way they could have gone through surgery because of wounds. We use lasers on them, and boy, like days versus weeks to months. I mean, it's amazing the speed at which things heal in the face of laser therapy. Definitely works very well on osteoarthritis and pain, acute pain, trauma, even, believe it or not, like dogs who have horrible ear infections that are painful, we can even use it on something like that. What you can't use it on, though, is cancer. Okay, absolutely contraindicated with cancer. So if your dog has cancer, it is a no-go for using it in the area that has cancer, depending on the type of cancer, because that could actually make it worse. Okay. So that is one other alternative there. And then I was just, what was the other thing I was thinking of? Laser, acupuncture. We started to talk about. Many veterinarians are certified in acupuncture. There are 2 web pages to find a certified vet you can go through to. One is IVAS, and one is the one that's from the Chi Institute. I think it said, TCVM. You see the one that says tcvm.net? That's another one. And this will be somebody who is not only certified in acupuncture, but certified in maybe food therapy, Twina, massage therapy. And these are all veterinarians who went through extra training to learn acupuncture. Acupuncture has first off, the dogs and cats love it. They really do. You would think that they wouldn't want you to stick all these needles in. They don't feel it, and they really get calm very quickly. Most of them fall asleep during treatment. They will be a little tired after the treatment, but then the next day people report like a huge difference in improvement. So acupuncture is one of those things that 70% of dogs treated will respond to. In the same as in people, there's always a group of non-responders. 3 treatments. If you don't see improvement by the 3rd treatment, after the 3rd treatment, your dog's a non-responder. There's no point in continuing it beyond that. But the amount of pain management that you can do is awesome there. There's canine physical therapists out there. There's a place local called Tales of Rye. They're excellent. There's a few others that do underwater treadmills, that do, certain PT modalities that can be helpful. There are veterinary chiropractors, definitely can be helpful as well. And most of your acupuncture veterinarians will also do herbal medicine and supplements, things like that can help with pain management. So those are some things to explore. And I was thinking about one other item, if I can find it. It just escaped my mind.
I'm trying to bring up a map here for the general area, but it's having a hard time loading as we're talking here.
Okay. So we talked about
just wanted to see who's local.
Talked about electromagnetic, pulse electro, laser, diet.
So we're just after 7 o'clock.
Those are pretty much everything, Okay. Yeah, I mean, there's other things you can do too, but those are like the things that come to mind immediately. And if people have additional questions, we certainly can reach out. Yeah, they can reach out and we can chat about. Oh, I know the last thing. I'm sorry. I'm going to tell you one more. I'm going to give you a I just remembered the other part that was really important. So there is, and I don't know if you've heard with people, regenerative medicine. So meaning PRP, platelet-rich plasma, stem cell, things like that, to deal with pain. I don't know if you've heard of that in people. They do that. Well, we do it in veterinary medicine. And in fact, we've been doing it longer, I think, in vet med than we have in human med sometimes, because we started there. The last link I gave you was called VetStem. If you could pull, there we go. So VetStem is really, really amazing. And what it is stem cell. And some vets will do PRP, which is not the same. That's using the platelet-rich plasma from your pet. But what this is if you have a dog, let's say, that's got an arthritic knee or is on chronic pain meds for really significant osteoarthritis, they can harvest a little bit of your pet's fat from maybe behind the shoulder or another area on the body. And it's a small incision. They scoop out the fat. It's kind of like, doggy liposuction, right? And then we send that to the company. This company is one company that does it, called VetStem. And they make a culture of stem and grow it out, make a culture of stem cells. And a few days later, that comes back to the clinic. And then we do an injection into that joint that's affected by osteoarthritis, whether it's the knee, the hip, the spine, whatever the case is. And before we do this, we've presented the case to the VetStem people so that they are comfortable that the manner in which we're going to use this will be appropriate for this, for this therapy. So it's run by their vets, run by us, and your veterinarian would have to be certified to do this. I'm a certified VetStem vet. There are other ones in the area, and it's pretty amazing. And so if it's something that you're interested in pursuing, I've had dogs that I've been able to get off of 100% of their pain meds with this. And so it doesn't necessarily fix the problem, but it will heal in some cases, but in a lot of cases, it just reduces that inflammation long-term to where they don't need meds anymore. So it's pretty impressive. It doesn't work on everything, but it definitely works on a lot of different things. So it's something to know about and know that it's available.
It's amazing how far the medicine and the science has come for pets. I love it.
Yeah, it's great. And, unfortunately, they all come with a price tag, for us to offer those kinds of things. It's not your $40 treatment, but, a vet stem case can be, $1,800 to $2,400 for a case, but at the same time, maybe a little more, I don't know. But, if you have a 7 or 8 year old dog, it would be worth that to not have them resigned to a lifetime of medication, which might, by the time you're through, cost you more money in the long run, along with lab work and monitoring and everything else that you have to do. So,
well, do you know if pet health insurance covers any of those holistic treatments at all?
Depends on your insurance.
Oh, really?
Yes, no, some actually do. Laser is typically covered. But like Trupanion would have like an acupuncture rider or chiropractic rider or holistic rider that you can put on separately, which I would encourage you to do. Some will have a PT rider. Some will cover it depending on the condition you're treating. You probably wouldn't get stem cell covered. That probably is a non-covered item. But there are plenty of things that we can do that would be covered.
Okay, great information. Thank you. I mean, pain management is a huge, huge issue, and you've helped to bring a lot of light to the subject. And I didn't realize how many, non-prescription remedies there are for potentially treating pain and making your pet more comfortable. So thank you for bringing that to light.
Lots of things. It's not the be all end all. And you have every pet's going to be an individual, and you have to take each pet by itself and figure out the severity of the pain, where it's coming from, and then design that program around what's most likely to work for that type of pain for that pet, and what their activity level is, and what they're able to do, and things like that, and what their mobility restrictions are. So, pain, you can, everybody here has probably had an injury at some point in their life. Maybe they've had to go to a physical therapist and they're super painful in the beginning, but the more they move and they work through those injuries, the less the pain becomes. Same thing with dogs, or any animal, so we don't want to just throw pills at everything. There are other alternatives to decrease pain other than medication. We don't worry too much that your dog's going to get addicted to opioids. It's not the same as in people, where because you're controlling what they get, and, we don't have the addiction issue. We do worry about prescribing too many opioids to people, for the pet, because that certainly does increase the possibility of abuse. And we're restricted by the DEA and federal and local laws by how much we can prescribe at a time. And it gets to be, I don't like to prescribe long-term narcotics if we don't need it. But for those dogs who are severe, like, if we have a cancer that's severe, it's certainly appropriate in a palliative care or, environment.
Well, thank you very much, as always, for sharing these tips and resources with us.
My pleasure.
So helpful. Everybody, for submitting your questions and for your comments. We really appreciate it. You keep Dr. Boyer on her toes, but she obviously has the answers for you. And if you do want to learn a little bit more about Dr. Boyer, you can visit her on Facebook at Supreme Point Kennels. As she had mentioned, she is a breeder as well. And you can always reach out to her there.
Yep.
Or you can stay tuned for next month when you will see her again. And we'll be bringing another topic to you and answering your questions as well.
Great.
So thank you again, Dr. Boyer. Hope everybody has a great night.
Hope you have a great night. Thanks.
Bye, guys.
Bye.